With this week's Cardiology Countdown, following the AIM High results, we have 3 publications. The first dealing with a novel antiplatelet agent for stroke. So this was the PERFORM study published in The Lancet that looked at an agent called Tirutroban, which is a thromboxane prostaglandin receptor blocker, seen in animal models to have superior antithrombotic effects relative to aspirin. It was studied in a very large trial, 9,500 patients, randomized with a recent ischemic stroke and some with TIA, to aspirin, 100 milligrams a day, or the new agent. And they found similar event rates, but it did not meet the very strict non-inferiority. And they found no advantage on bleeding, a little bit more minor bleeding with the novel agent. And so an interesting attempt to try and find new antiplatelet agents, which for prevention of stroke has been very difficult. Even dual antiplatelet therapy has had difficulties. And so yet another hard finding in the prevention of stroke. At the number 2 spot is the first of 2 dealing with anticoagulation, and first one is a acute anticoagulation in the setting of ST elevation MI. This was an analysis called Horizons Switch that looked at patients within the Horizons AMI trial that had gotten a bolus of intravenous heparin in the emergency department. And so by protocol, patients either did not receive any further heparin, then in the heparin and 2B3A arm began heparin at the time of PCI, or for the bivalirudin arm began bivalirudin in the cath lab. And they found advantages, as was seen in the trial as a whole, for bivalirudin, with a lower cardiovascular mortality and MI rate, lower bleeding, and no difference at 1 or 2 years in overall stent thrombosis. And so they found that as opposed to switching from heparin to a different antithrombin agent in this setting in ST elevation MI, it looked very favorable. And indeed, at Columbia University's acute MI protocol, they begin with an IV bolus of heparin in the ER, no drip, and then switch over to bivalirudin in the cath lab. Now, at the number 1 spot this week deals with chronic oral anticoagulation with warfarin, and it's the first report from the Auricula program in Sweden. This is a registry of patients managed at anticoagulation centers in Sweden that use the Auricula program for titrating and dose selection. This is a web-based program that works off of the last 2 INRs to adjust the dose and incorporates age and weight, I believe. They found the time in therapeutic range was 76%, and that is well above all of the recent randomized clinical trials that used warfarin and a novel anticoagulant. And usually we see better results in randomized trials, and so this is a demonstration that this program may contribute to very excellent control with warfarin. They found that the excellent control held up even for patients going up to age 90, and thus a way to try and improve warfarin anticoagulation. So for this week's Cardiology Countdown, I'm Chris Cannon.